1. Which theorist proposed the concept of the zone of proximal development or ZPD? A. Jean Piaget. B. Lev Vygotsky. C. Erik Erikson. D. B. F. Skinner. Two. At what age do most children begin to display object permanence, according to Piaget? A. 2 months. B. 4 months. C. 8 months. D. 12 months. Three. Which of the following is a key aspect of Erikson's stage of autonomy versus shame and doubt? A. Development of trust in caregivers. B. Encouragement of independent decision-making. C. Learning moral reasoning. D. Forming secure attachments. Four. Which fine motor skill is typically developed by a 3-year-old child? A. Holding a crayon with a tripod grip. B. Skipping with both feet. C. Writing their full name. D. Cutting complex shapes with scissors. Five. What is the best way to support language development in infants? A. Correcting their grammar. B. Talking to them frequently using rich vocabulary. C. Using flashcards for memorization. D. Limiting exposure to new words to avoid confusion. Six. Which of the following best describes an effective early childhood learning environment? A. Rigid and structured to minimize distractions. B. Flexible and responsive to children's interests. C. Focused primarily on worksheets and memorization. D. Silent to promote concentration. Seven. What is the best strategy to encourage cooperative play among preschoolers? A. Assigning individual activities. B. Providing open-ended materials for group play. C. Setting strict rules for interactions. D. Avoiding group activities. Eight. What is the primary purpose of a learning center in an early childhood classroom? A. To minimize free play. B. To provide opportunities for hands-on exploration. C. To ensure children stay seated. D. To replace teacher-led instruction. 9. A developmentally appropriate way to introduce math concepts to toddlers is by A. Using flashcards with numbers. B. Encouraging counting through songs and games. C. Giving worksheets for number writing. D. Teaching multiplication early. (10) Why is sensory play important in early childhood development? A. It helps with standardized test preparation. B. It engages multiple senses to strengthen cognitive growth. C. It keeps children occupied. D. It replaces social interactions. (11) What is the most effective way to build positive relationships with families? A. Sending home weekly behavior reports. B. Encouraging regular communication and involvement. C. Limiting interactions to parent-teacher conferences. D. Only contacting families when issues arise. (12) When a family speaks a different language at home, what is the best approach? A. Insist they use only English with their child. B. Encourage the use of both home language and English. C. Discourage home language use to prevent confusion. D. Ignore language differences. (13) How should teachers support families experiencing stress or crisis? A. Provide information about local resources. B. Avoid discussing personal matters. C. Assume the family will handle it independently. D. Limit communication to avoid overstepping. (14) Which strategy fosters cultural competence in the classroom? A. Teaching only about widely celebrated holidays. B. Incorporating diverse books, materials, and traditions. C. Avoiding discussions about cultural differences. D. Treating all children the same without acknowledging differences. (15) When planning a family engagement event, what is a key consideration? A. Scheduling it at a time convenient for educators. B. Ensuring accessibility and inclusivity for all families. C. Requiring mandatory attendance. D. Limiting participation to immediate caregivers. (16) What is the safest way to store hazardous cleaning supplies in a childcare setting? A. In a locked cabinet out of children's reach. B. On a high shelf without a lock. C. Under the sink for easy access. D. In an open container for quick use. (17) Which of the following is a symptom of an allergic reaction in children? A. Sneezing and mild cough. B. Difficulty breathing and swelling. C. Slight fatigue after eating. D. Increased energy levels. (18) What is the best way to prevent the spread of germs in the classroom? A. Sanitizing toys weekly. B. Encouraging frequent hand washing. C. Keeping windows closed. D. Limiting outdoor play. (19) What is an appropriate response if a child falls and has a minor cut? A. Panic and call emergency services immediately. B. Clean the wound with soap and water and apply a bandage. C. Ignore the wound unless bleeding persists. D. Send the child home immediately. (20) Which snack option best supports healthy child nutrition? A. Chips and juice. B. Whole grain crackers and fruit. C. Candy and soda. D. Processed snack bars. (21) What is the primary role of a mandated reporter? A. Observe children but avoid reporting suspicions. B. Report suspected child abuse or neglect. C. Wait for concrete evidence before acting. D. Discuss suspicions with other teachers before deciding. (22) A teacher's personal biases should A. Influence how they interact with children. B. Be recognized and managed to ensure fair treatment. C. Be openly shared with families. D. Determine classroom policies. (23) A professional early childhood educator should handle conflicts with colleagues by A. Discussing the issue with parents for advice. B. Addressing concerns directly and professionally. C. Avoiding interaction with the colleague in question. D. Reporting every minor disagreement to the director. CDA. The Child Development Associate or CDA credential is a nationally recognized certification in early childhood education, awarded by the Council for Professional Recognition. It is designed for educators who work with children from birth to age 5 in various settings, including preschools, childcare centers, and family childcare homes. The CDA credential demonstrates a professional's knowledge, skills, and commitment to fostering young children's social, emotional, physical, and cognitive development. To earn the credential, candidates must complete specific training hours, develop a professional portfolio, undergo classroom observations, and pass a verification visit and written exam. Holding a CDA can enhance career opportunities, improve teaching practices, and support high-quality early childhood education programs. Here are 5 top beneficial uses of CDA. 1. Career advancement. The CDA credential enhances job opportunities in early childhood education, qualifying educators for positions such as lead teacher, assistant teacher, or child care center director. Many employers prefer or require a CDA for hiring and promotions. 2. Improved teaching skills. Earning a CDA ensures educators develop essential competencies in child development, classroom management, and developmentally appropriate practices, leading to more effective teaching strategies. 3. Higher earning potential. Many early childhood education employers offer higher salaries to professionals with a CDA credential, recognizing their specialized training and commitment to quality education. 4. Increased quality of childcare. Educators with a CDA are better equipped to create safe, nurturing, and stimulating learning environments, positively impacting children's social, emotional, and cognitive development. 5. Professional recognition and credibility. Holding a CDA credential demonstrates a commitment to professional growth and best practices in early childhood education, enhancing credibility with employers, colleagues, and parents.